Good morning. It is Tuesday, September 21st. We are live inside the Dolph Simons Jr. Family Broadcast Studio. Welcome into the Morning Medical Update. Today, we are taking a look at what not to do. Right now, Georgia hospitals are in crisis mode. COVID is taking over their patient load, and it is creating even more nursing shortages. We talk a lot about that. So we're going to look at what we can do right now to avoid ending up in COVID chaos. But first, Dr. Dana Hawkinson joins us this morning. Good morning to you. How did we do overnight?
Hi. You know, we're holding steady, kind of right now in that mid-30s to 40s. Currently, we have 40 active infections, 17 in the ICU and 9 on the ventilator, still 31 in that recovery period. So our total is 71, again, down from 100 that we saw 6 or 8 weeks ago, which is good. We want as less as possible. And again, we also said that really hospitalizations here and around our community are going to be the real bellwether as to how this surge is going, and hopefully overall the surge is decreasing, especially now as we are going to be getting in to cooler temperatures, and when people are meeting out gathering, they're probably going to be gathering more indoors than they are outdoors, as they have been able to do in the spring and through the summer. Hays also has 11 total patients, 6 active and 5 in that recovery as well.
Okay, I probably wasn't the first to issue a happy birthday today, but maybe the first publicly to issue a happy birthday.
Yeah,
and
great. Thanks,
look at this little guy. Can we pull up a little blast from the past?
Yeah, Big Bird.
What are you
Big
doing
Bird.
to Big Bird, I think has been the question. Choking him out?
He's a good friend. No.
He's a dear friend.
I'm not choking anyone out. No.
Is this sister?
Yeah, we're having fun. We're just kind of, I think we were on a ferry up in northern Michigan at that point. But,
Well,
yeah.
happy birthday to you.
Thank you.
Yeah, okay, it's gonna be fun. We're gonna show some more pictures. Your Mama Hawkinson.
There's more? Oh, no.
Yeah, Mama Hawk sent some more pictures. We appreciate you for doing that.
Yeah.
So you're gonna take us down memory lane. We're gonna dive back into the Hawkinson family photo albums here in just a few moments.
Yeah.
But let's check in with any reporters on the line today.
Good morning. This is Charlie Keegan from KSHB 41. How are you all doing?
Hey, Charlie, how are you?
I'm great, thanks. We got some press releases from J&J this morning talking about how their efficacy is up and good for booster shots with its vaccine. What do you take from that?
You know, I think it's what we've kind of talked about with the other vaccines. There was always that bigger question of, and certainly they were trying that over in England about, well, what if you delay that second dose of the mRNA vaccine? Will it, number one, hurt anybody from not getting that second dose in those 3 to 4 week time periods, but also will there be some increased immunity? We know that J&J was able to put out and get authorization for that one dose, but we have said before on this show that, you know, likely a 2-dose regimen would be efficacious as well. Now, we've seen the press release, would still like to see all of the data, but I think it's just consistent with what we have seen with the mRNA vaccines. Certainly, with that first dose of vaccine, you get that immune system primed. You get it focused on the spike protein. So you are developing antibodies to that spike protein. You are developing the T-cell responses to that spike protein. As you give that second dose of vaccine, you are then increasing that specific immune response that has occurred with the first one. So you are increasing the amount of B cells. You are increasing the amount of T cells. And also what we have seen with the 2 doses of the mRNA vaccines is you actually continue to have further expansion of that immunity. And your B cells actually do change and mutate, if you will, as they go through this evolutionary process to continue to create antibodies that are now able to effectively block variants that we have seen, and we have seen this, but also possibly variants that we don't know about. I suspect the same thing is probably going to be going on with the Johnson & Johnson vaccine, and I think it's good news because there is that select proportion of people that did get Johnson & Johnson vaccine and did feel somewhat left out, but now this new data is coming forward, and again, it continues to be consistent with what we've talked about, is that the vaccines that we currently have, no matter what variants we have seen, still offer great protection. And getting that second dose of vaccine, once all the data is analyzed and the recommendations come out, is going to be a good thing to do and continue to provide protection to people throughout this pandemic.
All right, I do want to ask, oh, Charlie, did you have a follow-up question?
No, ma'am. Thank you much.
Okay, sounds good. Anybody else on the line? So Donna over at KMBC had a question, and you may have already answered it, but I was looking at questions, and so I want to make sure that we got hers answered. And she did wish you a happy birthday, by the way,
Yeah,
Dr.
thanks,
Hawkins.
Doc.
Lots are coming through, so
Yeah,
I'll read
great.
some of those in a moment. So I just want to make sure you covered all of this. What about folks who got the J&J shot earlier in the year, who are now 6 months plus out from that first dose? J&J claims its study shows people who got the second shot after 6 months had higher antibodies. Does that mean these folks will have even a better boost? So basically, when and if those boosters are available, when is the ideal time for people to get that second shot?
Yeah, I think what we need is number one, for that all of the data to become publicly available. We'll certainly wait for ACIP to meet and review all the data, as well as the FDA, and then provide recommendations based on that. But luckily, what we still have seen is that even with that one dose of J&J vaccine, you are still very well protected against that risk of going to hospitalization and ICU. So, ever since there was talk about a third dosing for the mRNA vaccines, a lot of the people who had gotten Johnson & Johnson did feel left out. This is one good step towards answering some of those questions. We just have to figure out exactly how and when we would give additional dosing of Johnson & Johnson vaccine. But again, I think that some of those questions are going to be answered, and it sounds like we will probably be seeing recommendations in the near future. We know that the Committee on Immunization Practices does meet regularly, and I'm sure they will be going through and have already gotten some of this published and unpublished data, and hopefully we'll have some recommendations soon.
All right, Dr. Hawkinson, thank you so much for that. Any other reporter questions today before we get to our guest? All right, well, let's get to our guest, Dr. Amber Schmidtke. She is the Chair of Natural Sciences and Mathematics at the University of St. Mary in Leavenworth. Dr. Schmidtke, good morning to you. We're so glad you're with us, first of all.
Good morning. It's a pleasure to be here.
Great. Okay, lots to jump into. So you kind of understand what life is like in Georgia, certainly on a social level. You used to teach at Mercer University School of Medicine in the microbiology and immunology department. So I just want to ask you a couple of questions. So some of the headlines that have been surrounding Georgia lately are things like most COVID-19 outbreaks now in schools, Georgia hospitals in crisis as COVID patients load, they set new records. So what is happening in Georgia right now?
Well, if you could, I have a couple slides that I brought with me. And so we'll look at the first slide, which should be number 2. But while that's coming up, what I'll say is that thankfully things are starting to recede in Georgia. So what you're looking at here is a graph that shows how cases, hospitalizations, ICU admissions, and deaths have trended over time. And what you'll notice is that every case surge trends up with hospitalizations almost at the same time. Those two trends go together. We see that ICU admissions and deaths are lagging indicators, meaning that they follow those initial surges. And so what we're seeing recently is that Delta peaked in Georgia around Labor Day. And thankfully, cases and hospitalizations are going down. And what I can share with you, if we move to the next slide, is we've learned some things about what helped us to predict where the pandemic was going to hit hardest. And so the 2 points of vulnerability were areas with low vaccination rates and high test positivity. So first, let's talk about areas with low vaccination rates. On the graph or the map at the top right, you can see the state of Georgia, all 159 counties, and how they were doing with vaccination status prior to the Delta surge. And anything with like a light green or white color is in the danger zone. We saw good and decent vaccination rates in the Atlanta metro and some of our more populated spaces. But there's 2 regions in particular I want to pay attention to. And those are the southeast corner of Georgia, coastal Georgia, actually the whole south of Georgia. And you see here with high test positivity that there were a lot of counties that had very high test positivity even before the Delta surge began. And that's important because what it means is even when cases were low, they didn't have enough test capacity to properly get their heads around what was circulating then, never mind what would happen when Delta arrived. And unfortunately, these 2 indicators were really strong predictors of where the surge was going to hit hardest. So we'll advance to the next slide. Georgia is broken up into 14 different hospital regions. And the two regions we want to pay attention to most in this are going to be, actually there's three, K in the southwest corner and 2 in the southeast corner called M and J. And what we see is actually in hospital region L, which is right there in the middle of the south of the state, that's where the I-75 corridor is, leading from Atlanta down into Florida. And what you can see is that that is actually the region where the Delta surge began in the graph on the right. And then it spread to the east and west along that I-75 corridor. And unfortunately, it brought disease to the areas that were most vulnerable to not being able to see how bad disease was and didn't have underlying protection against it. So thankfully, we are seeing that those case rates are coming down. If you pay attention to the line at the bottom, it's yellow, it's for hospital region D, that's the Atlanta metro. And they never did see things spike. And that is because they had the highest vaccination rates in the state. And unfortunately, so this graph, what we're looking at here, again, this is case rates. We'll go ahead and advance to the next if we can. What we can see is what that meant for hospitalization. So for those three regions that I talked about, remember before, this is looking at patient census. So how many of the patients in hospital are there because of COVID-19? We can see that all three of these regions, J, M, and K, have hit census levels that were higher than anything they had ever seen. So Delta was aggressive. Delta hit hard, especially in these areas. Go ahead and advance to the next slide, please. And so, unfortunately, cases feed into deaths. And so what we see is that the human toll of this, and we're still reckoning with this because death surges follow case surges, and we're still very much in the midst of that. The regions that were hit hardest with cases, that hospital region L, that region along the I-75 corridor, they have an exceptionally high death rate, and so does hospital region M in that southeast corner. So unfortunately, we were able to see this coming, and despite warnings from people like me, we still ended up with kind of the worst possible outcome for these communities. So I think that's all I had to share from the slides. We can advance to your next question if you'd like.
Wow, you really, I was hanging on your every word, Dr. Schmidtke, because I think you really explained that very, very well about the movement around the state and how we get to where we are and why. So thank you for that. So in the past week, cases went down, but ICU admissions and deaths rose. And kind of elaborate on that, but kind of tell us what that data means.
Yeah, these are what we call lagging indicators. And what I mean by that is that, the cases and the hospitalizations get going first, but it relates all back to the disease course for the virus. It takes time for a person who is going to need intensive care to get to that stage. And it's unfortunately for those who pass away, that also takes time. And we shouldn't ignore the fact that we have problems in public health when it comes to delayed reporting of deaths. So sometimes people die and it has to go through the vetting process of whether it actually counts as a COVID death or not. And that can take time too. So we usually see in Georgia a 3 to 5 week delay between the surge in cases and the surge in deaths. For the Delta surge, it was 4 weeks exactly. So what this means is that we should anticipate a couple more weeks of really high death counts and ICU admissions. Delayed after the peak that we saw for cases. Remember, they peaked around Labor Day. So we should expect numbers to still be very high until about 4 weeks after Labor Day for Georgia.
So in your mind, was this inevitable? What could have been done to maybe avoid that, or is it unavoidable? What's your insight on that?
It was preventable. Yeah, it was preventable, but I think that it's inevitable in the reality that Georgia never really took this pandemic seriously, which is really unfortunate because the CDC headquarters is in Atlanta. But what we're seeing here is that, the state of Georgia had among the lowest vaccination rates in the country when the Delta surge began, and they've always chronically underfunded public health. So that means even in the pandemic, I should add, they've been relying entirely on federal funding. They haven't been willing to donate any of their rainy day funds to the pandemic. It just unfortunately has not been a priority. And so when you have reduced testing capacity and you also have, sort of these, lukewarm efforts at trying to vaccinate your population, it's sort of a recipe for disaster. All of this was predictable, but it was also very much avoidable. And so I hope that very much that the lessons that we've learned from Georgia can be applied to other states so that they can avoid this similar loss in life.
Right. Yeah. Learning the lessons. That is the key. Kentucky. We do not want to be Georgia. So what can we do here? I say we as in just the regular public. What would be your message to avoid being in this similar position down the road?
Right. So trust me, I want to avoid it too. And so I think what we can do to try to avoid this is do what we can to increase vaccination rates, of course, but also make sure that there's ample testing. One thing that we've noticed in Georgia and also other states that have a significant rural versus urban divide is that the pandemic is hitting rural communities particularly hard. And some of that has to do with difficulty with accessing healthcare, but also perceptions and attitudes about the pandemic, sort of an idea that we're self-reliant and invincible. And unfortunately, that hasn't come to pass. And so again, anything you can do to make sure that you are being responsible in your community by wearing your mask, getting tested frequently, especially if you're having high contact exposures, and getting vaccinated. Those are the big things that we can do. And really, it's just, the strategies that we've been using this whole time, and a lot of people are tired of doing, they still work. So we need to use those in addition to our vaccines and of course, get as many people vaccinated as we can.
So I had another media question come in, and I'm going to give it to both of our doctors here today. Nathan over at Channel 41, and I'm just going to read this so I make sure I get all of his points in. It says the New York Times has cited several studies that seem to show that the different variants have generally followed a 2-month cycle, a surge in cases, a plateau, followed by a decline in cases at almost the same rate as the surge. We are generally starting to see that play out across the country. What do you make of that 2-month cycle? Do you think that we have reached that plateau? Do you think that schools reopening, packed stadiums, more indoor gatherings and so on, now it's going to get colder? Do you think that's going to affect the cycle?
I'll go first, I guess. Yes, we have seen exactly a 9-week surge in Georgia, and that's exactly what Missouri saw too. From going from base to peak, it took 9 weeks, and that proved to be the same for Georgia. But whereas in the South, you're seeing that, yes, the cases and hospitalizations are descending almost as rapidly as they rose. That's not necessarily the case for Missouri and Kansas. They have risen and they've declined, but they've stayed at a high level. They haven't descended as rapidly as we have seen for the South. And so a complicating factor for that is schools reopening. In Georgia, schools reopen at the very beginning of July, sometimes in in the beginning of August, sometimes late July, whereas in the Midwest, it tends to be a little bit later. So we may be seeing a bit of a delayed effect in what's going on in the data for the Midwest. But yes, it is a concern to see that, as we head into the winter months and we see still a sort of perception that the pandemic is over and people aren't being quite so risk averse, it is concerning to see those big crowds of people gathering together. We just have to see what happens with the data.
Dr. Hawkinson, do you have the same concerns?
Yeah, absolutely. I mean, I think, I mentioned a little bit earlier, as things kind of cool down and people are going to be now more gathering indoors rather than outdoors, I think that will play a great part. But, we need to keep making people or letting people understand that the vaccines are safe and extremely effective, and keep getting those unvaccinated populations, those that are eligible for vaccination, to get vaccinated. And that is really where we are going to keep our community protected, keep our economy protected, people working, keep kids in school. That's going to be very important. And we heard maybe within the next few weeks that vaccination for children under 12 is going to be authorized. And I think that is another great step towards keeping everybody healthy as well.
We're going to get to our community questions because I know a lot of folks have questions. And Dr. Schmidtke, I'm going to circle back to you because I want to talk a little bit about kids and the Pfizer FDA sending on to the FDA for their approval. I want to get back to that in just a moment. But we've got some questions coming in for you. But this first one is for Dr. Hawkinson. Jean wants to know, good morning, Jean. Can the flu shot be taken with the booster Pfizer, or should they be separate in time? We get that question a lot, but it is flu shot season. So what can you advise folks?
Yeah, we were just on a CDC call a week or two ago, and they addressed that it was about influenza vaccine, but they did address giving dosing. And you can actually get dosed with the influenza vaccine as well as with a COVID-19 vaccine at the same visit. So you can certainly walk into a pharmacy, walk into your local physician's office. You can get both doses of those vaccines at the same time.
Isaac, good morning to you. He wants to know, Dr. Hawkinson, if boosters are approved for a wider audience, will the definition of fully vaccinated change as far as admissions to workplaces or events, as far as that's concerned? I could see this having huge implications.
Yeah.
What are your thoughts?
It's hard to say what specific businesses will do, but certainly we had that concern. Again, probably if you are immunosuppressed to be fully vaccinated, you are having those 3 doses. As we move further in time, looking at vaccine effectiveness against any infection whatsoever for COVID-19, or vaccine effectiveness against hospitalization, severe disease, and death, certainly our definition of fully vaccinated may change as far as the CDC and medical realm go. It will be difficult to really understand exactly what those private businesses or institutions may consider fully vaccinated. But moving forward, that is a good question to ask, and I think we just need to continue to follow the science data and wait until further recommendations are made for additional dosing, particularly those in those highest risk groups.
So, Dr. Schmidtke, kind of on that same topic of large crowds, another question is, what hospital region of Georgia includes Athens, home of UGA? I want to see how they're doing, because football fans like me want to know what the effects of the stadium crowds might be. Your thoughts?
Yeah, so Athens is part of Hospital Region E. It's sort of in the north part of the state. And yeah, that's a good question, because, that football stadium can get quite full. And of course, when people are cheering for their team, they're often shouting and expelling those particles into the space. So far, Hospital Region E has really struggled with this pandemic. And for a time of several weeks during the Delta surge, they were completely out of ICU beds and having to contend with excess need. So they were converting conference rooms and hallways into ICUs and doing the very best they could with things. But it's important to remember that an ICU bed is more than just the bed itself, but the staff that's required to support that patient. And so, we were really testing the limits of what that region can do. And what's really concerning, too, for Hospital Region E is, of course, UGA is a huge contributor to the economic industry of that space. But, apart from the university, there's a lot of poverty, and communities of color have been hit especially hard in Hospital Region E. So there is a bit of a spillover effect that we're keeping an eye on, and it's certainly heartbreaking to watch.
Dr. Hawkinson, a couple of booster questions for you. Angela says, is Moderna approved for the immunocompromised as a booster dose?
I think for the immunosuppressed, I'd have to look back and see, but I think it's for any mRNA vaccine. If you've received 2 doses, you should go ahead and get that 3rd dose. If you do fall into those immunosuppressed populations, but you could certainly look to clarify. Currently, for the other additional or booster dosing, really all that was said from that meeting last Friday was that Pfizer was now approved to go ahead and do that. But again, we are still waiting for the final recommendations and the guidance on exactly who to give. We know that certainly those over 65, but they also mention other people who are at risk. That continues to be vague, so we'll look for further details on that. We have speculation what those things could be, like diabetes, obesity, heart disease, lung disease, but again, still waiting for the full details.
So then, to be clear, for Bobby wants to know, does having COPD and oxygen as well as over 65, also over 65, qualify that person for that Pfizer booster? That's what you just said, over 65, or is it over 65 with those other conditions?
No, it'd really just be over 65. Those other conditions will certainly contribute to you being in those higher risk categories, so you would still likely need to be able to get that additional dosing.
Okay, so Dr. Schmidtke, I want to get back and talk about some kiddos. That's always a popular question and a topic that people like to talk about. So your child was recently exposed to a COVID positive case at school, I understand. So what are your thoughts about kids quarantining from school? Especially now, like for Kansas, we're not allowing any virtual options for students. So just kind of what is the effect of that? Just what are your thoughts? And certainly, how's your kiddo doing?
thankfully, he's still testing negative. We test every couple days with the at-home rapid antigen test. You don't get to be this deep in the data and not care about that sort of thing. So I think that, it was certainly a big shift for us mentally as a dual working parent household to try to figure out what was happening and how we were going to take care of his needs, but also ours for our jobs. And, of course, from a public health perspective, we need to be quarantining if we are exposed. But, it's 14 days that his entire class is out from school, and that's 14 days without instruction. And until we have that pediatric vaccine, he could go back to school in a couple days and be sent right back home if some other child brings COVID-19 into the classroom. And so this is really a frustrating situation because our school district did exceptionally well last year with virtual learning. We obviously have the talent and tools to pull this off. And I especially worry for kids that are on individualized education plans who require educational supports. They're not getting that during this time. And so we're going to see students really fall behind. And unfortunately, I don't know why we are in this position where we are, because again, we have the ability to adapt to this problem. But unfortunately, the folks in the state legislature have sort of made it clear that they don't want virtual learning to be a possibility. And it really just holds all our kids back.
Yeah, I bet you have to switch your researcher hat and your parent hat back and forth quite often when it comes to some of these topics right now. So just your thoughts of this week with Pfizer making its announcement that it's ready to send the vaccine onto the FDA for approval for kids 5 to 11. What effects do you think that will have? Just want some of your insight on that.
Yeah, I think, personally, huge sigh of relief. This is great news. We don't make decisions or policy based on press releases, however. So like Dr. Hawkinson said, we need to see the data and we need our regulatory bodies to evaluate it and make decisions. I hope that they will expedite that process like they have for the full FDA approval for the vaccines like we saw in August. This really needs to be an all hands on deck effort at the FDA and the CDC. What I will say for my own child, my older child is 12, and we vaccinated him on his 12th birthday. And we were out of town on vacation during that time. It was that important to us that we get him vaccinated. And for our 10-year-old, we're very much in the same position. As soon as we get the green light for that vaccine to be administered, we'll be pulling him out of school that day to take him to the nearest pharmacy or public health department that will have it available for him. I think that a lot of parents are in that position. They really just want to put this pandemic behind them. And even for myself, this pandemic won't be over until it's over for my children. And so very much this is the finish line that I'm hoping to achieve. Of course, we're still going to be taking precautions to protect our community, but it's a huge sigh of relief to know that all of our every member in our family will have at least some protection against the virus on board.
That could not have been said better. This virus is not over until everyone is protected, especially our children. So very, very well said. I have a couple of more questions, and then we'll get to final thoughts here, but a couple more came through. Dr. Schmidtke, you mentioned this a little bit before, but just if you wouldn't mind going over it again, but a viewer had a question. Here in the Midwest, cases went up last winter because more people gathered indoors due to cooler weather. Might this be the reverse in southern states like Georgia? Was that true last winter?
Yes. If you've not been to the South, our summers are nasty. It's hot and humid. They call it Hotlanta for a reason. And so when people in the Midwest tend to gather together in the winter because it's uncomfortable to be outside, the inverse is true for the South. And so we saw a summer surge last year that was kicked off by the Memorial Day holiday. And then this year it was kicked off by the 4th of July holiday. So that's kind of what the timing was for us. But we did see a winter surge. So the winter surge last year kind of started in the Dakotas and spread out and down to every corner of the United States. So it did eventually hit the South, and particularly Georgia. And that was the biggest surge we had seen prior to Delta. So unfortunately, Georgia has participated in every wave it has been invited to. And so I am glad for Kansas and Missouri that they have been able to limit the number of waves that they have experienced. And I hope that remains the case for them. But like Dr. Hawkinson, I'm very nervous about what happens for the Midwest during this winter, especially since flu is starting to look a little bit more active than it did last year at this time.
Dr. Hawkinson, any thoughts on that? Concerns? I know winter,
we
it's just...
We all have the concerns. And the way to help protect our communities is to get vaccinated.
So Jeannie says, my son-in-law says that she's heard that children receiving the Pfizer vaccine, Dr. Hawkinson, have developed blood clots. Any information, any facts on that claim?
I would have to look into that. Again, we know that the blood clots that developed with the adults was a totally different vaccine. So I haven't heard that. So, we could certainly look into it, but I would expect any of the major news media outlets, New England Journal, any of those things would have covered that. I haven't heard it, but can certainly look into that.
All right, I want to get to final thoughts. And Dr. Schmidtke, you said something. How did your son, first of all, feel about getting the shot as a birthday gift?
I felt like in some ways like a terrible parent, right? Because I'm giving him a vaccine for his birthday. But at the same time, it's one of the most important gifts I could give my children, a tool that will save their life. And that's really how we saw it. And so, he was a little bit reluctant about it, of course, but he's very shot averse typically, but he marched right in there with me and didn't have really any issues with it. In fact, when they swabbed him down and he was getting ready for it, he's like, just shoot me, in the sense that just get the shot on board. I'm ready to be done. So
that's fantastic. Yeah, the gift that keeps on giving. So, all right, I'm sure you made it up to him in other ways. But good for him, though, really setting the standard and probably being such a great role model to others and friends and stuff like that. So, as we're trying to get all those kiddos vaccinated, it's been a pleasure having you on. I hope you come back and share more information like this. You really laid it out in a way that even I can understand, and that's kind of. I know doctors speak between each other, but when I can understand it, I know you're doing it right. Hopefully for our viewers as well. So. Thank you for keeping it simple for that. Final thoughts from you. Just what do you want our takeaway to be from our conversation today for everyone?
I guess I would just remind people that we're all in this together. And in effect, we're in a tug of war with the virus, and the virus has a lot of tools still at its disposal. So in order to win in this war with the virus, we all have to be pulling together on the same side of the rope. And so that means that we need to get vaccinated. We need to wear our masks. We need to avoid crowds, especially indoors, and do what we can to limit this. We all want this to be over, but the way we get over this big hump is by all pulling in that same direction. So I would encourage people, if you haven't been vaccinated, to make that appointment today. If you have questions, reach out to your healthcare provider to get those questions answered in a meaningful way. But we all have a role to play in this, and our health is dependent on the health of others in this situation too. So it's really on us to make sure that everybody around us is in the safest position they possibly can be.
Fantastic. Thank you for your message today. We appreciate you, and we will see you again. Birthday boy, what are your final thoughts today?
Thank you for the guest for being here. She had such thoughtful and eloquent messages. I think spoke very well, just like you said. Just really made it clear. And we need to continue to look for the information. We know a lot of stuff has come out now about Pfizer and dosing for children and additional or booster dosing. We will continue to see the spread of the disease decrease if we can continue to get those that are eligible for vaccine but unvaccinated, get them vaccinated. And then again, hopefully within the next few weeks, get those at-risk children who are 12 and below, get them vaccinated as well. It will overall be better for our communities, be better for keeping them in school, for keeping parents at work, all that stuff. So good news is coming out. We just need to continue to do the right thing.
Do you need any shots today? Birthday shots? Anything?
I
wish you did.
I wish I
would
did
step
too.
right up.
If I were old enough, I would definitely, my birthday present to myself in a couple of years is going to be the shingles vaccine. So I encourage all of you who are 50 and above, please go get your shingles vaccine today. If I could get it earlier, I definitely would. I do not want shingles. So
Okay.
I'm going to give myself a vaccine for my birthday.
Oh, let me do
eventually.
it. Let me
Okay.
do it. Okay. So
good.
we are going to, I told you that Mrs. Hawkinson, who watches our
Yeah,
show, so
look at
hello
that.
to you and thank you for getting us these pictures. We're going to roll through the Hawkinson family photo album for Dr. Hawkinson's birthday. Keep these going, guys, if you don't mind, because I want to read a few as we get out of here today.
My grandparents.
Is that your grandparents?
Yeah.
Kind of go through those and grab those other ones with the duck. I
See,
love that one. Go
no
through these.
Star
I'm going to
Trek.
read some of our messages from our
Okay.
viewers. But Sandy says, Dr. Hawkinson has a birthday today. Happy birthday. Hope it's wonderful.
Yeah.
Justin is watching from Greece, by the way.
Oh,
So
nice.
hello from Greece. Let us know how you're doing from
Yeah,
all the
hope
way
you're
over there.
in
That's
Mykonos. That'd be
fantastic.
great.
Ray says, happy birthday, Dr. Hawkinson. Mary Lou, happy birthday, Doc Hawk. We sure appreciate you. Happy birthday, Dr. Hawkinson from Salina, from
My
Susan.
grandparents.
There you go.
Grandma Stella,
There
Grandpa
they
Darryl.
are.
Yeah.
Is that your grandmother?
Yeah, she just
Did
passed
you-
away.
Yeah,
yes.
that's a great pick. So lots.
Wonderful.
Constance says, happy birthday, fellow Virgo.
That's
So-
right.
Barb, happy birthday, Dr.
No
Hawkinson.
Star Trek, but there's Star Wars. There's an Ewok.
Is that you and your Ewok?
Yeah.
Gina says, happy birthday. Thank you for the information and transparency. Kim says, happy birthday. And so everybody just.
My Uncle Dennis. Nancy,
Oh, who
my
is
dad's
that?
brother.
Who are those
my Uncle
folks?
Dennis. He passed away quite a few years ago, and that's his wife Cindy as well, my Aunt Cindy.
Great,
So
great pictures. I love it. I love it. Look at that. You are soccer. You were soccer all the way through what,
Yeah.
high school?
yeah, through college, through
All
through
right.
old age too.
I asked your mother to send us some fun pictures, and she definitely came through. So I appreciate that very, very much.
Yes, thank
Happy
you.
birthday to you. One of us will be getting you a strong coffee or something today. So
I definitely need it.
I hear you. It's a Tuesday.
Caffeine is good. It is a good drug. So.
That is one we suggest. Okay.
Yes.
All right. So happy birthday to you. We'll celebrate here in the office. Thank you all for being with us today. We appreciate you as always. Tomorrow we are back with another morning medical update because Dr. Stites, he's off tomorrow. He's vacationing and taking a little much needed rest and time away with his family. So we're happy to let him have that. We know, though, that Americans spent most of the past 20 months at home. COVID-19 had people canceling trips, canceling vacations. As travel increases, we're going to hear from Dr. Gary Morsch with the COVID Care Force on how countries are cracking down on regulations. So it is fantastic to have him with us. So we'll talk more about that. And just everyone have a fantastic Tuesday. We'll see you back here at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.